Good evening, one and all. Welcome all to VayoManasa Sanjeevani's webinar series. Today's webinar topic is memory and forgetfulness in elderly. Is it normal or abnormal? To talk about this, we have Dr. Subhashini K.R. I welcome you, ma'am, for today's session, and I would like to welcome our moderator for the day, Smita V. Welcome, Smita, for today's session. Introducing Smita, she is doing her MA in psychology and also a volunteer at Wellbeing Volunteer in NIMHANS, as well as an active volunteer of VayoManasa Sanjeevani. With that, I would like to welcome all our Zoom and YouTube participants for today's session. At the end of the session, we will be enabling you to unmute your mic. You can ask your questions and share your experience with our Dr. Subhashini ma'am. Now I request Mrs. Smita to address our speaker. On to you, Smita. Thank you.
Good evening all. I welcome you all on to 81st webinar series of VayoManasa Sanjeevani. I welcome all the Zoom and YouTube viewers as well. First of all, VayoManasa Sanjeevani is head by it's an initiative by Dr. P.T. Shivakumar and other team members of Geriatric Clinical and Services, Department of Psychiatric, NIMHANS. The current programs under VayoManasa Sanjeevani are Monday's public awareness webinar, theme based in group meetings conducted by volunteers, Saturday activity sessions. The goals of VayoManasa Sanjeevani are to promote age-friendly for senior citizens, age-friendly community for senior citizens, promoting awareness on aging and mental health, training for lay counselors, volunteers, and caregivers on geriatric mental health, etc. So for this, I welcome Dr. Subhashini to address today's webinar. The webinar of today is, sorry, just a minute. Sorry for the disturbance. Dr. Subhashini is a senior resident and PhD scholar, Geriatric Clinic and Services, Department of Clinical Neuroscience, NIMHANS. And ma'am is also doing a research on brain stimulation in cognitive impairments. Ma'am, I welcome you to the webinar.
Hello. Yes. Can you just give me 1 minute? I will just start it.
Sure, ma'am. Sure.
I'm so sorry. There were some issues at work that had to be sorted. Thank you, Ms. Gina, and thank you, Mrs. Smita, for that wonderful introduction. And I also, I'm very thankful to the VayoManasa Sanjeevani team for including me as one of the resource persons for this talk. And I feel extremely honored to be a part of this wonderful forum, and also amidst all the senior citizens here. It's really a very wonderful opportunity. So I, as Ms. Gina and Mrs. Smita had told, today's session is about memory and forgetfulness in the elderly. So, and whether it is normal or abnormal, and what is normal. So, yeah. So I will, the session will be like, initially we'll have a PowerPoint presentation for 15 minutes. And then we will go ahead with a few questions. And then we can take questions from the audience. Okay. Before that, I wanted to check if my audio is clear.
Yes, ma'am. You're audible.
Yes. Okay. So I think this memory and forgetfulness is one very common thing which is bothering most of the senior citizens, and also I think even not just senior citizens, I think even adults are also bothered about their memory. So we need to actually differentiate between what is normal and abnormal, because sometimes our fears may be unfounded. It's something which may be normal, we may be thinking it as abnormal and getting worried often. And this concern is more important in senior citizens, because I understand that senior citizens are more worried about their physical and mental health as they age. So, so what is normal and abnormal? So mainly we need to look at these things like memory loss. So a person's memory and thinking just doesn't involve just forgetting where they have kept things or forgetting appointments and all. Our brain is a very complex organ in the body, which has a lot of activities, including the cognitive activities. So the cognitive activities include memory, planning and problem solving, and being familiar with the tasks which we have already learned, and orientation to our time and place, and our ability to understand visual images or spatial I mean like spatial span, and also speaking, reading, writing, and judgment, and about their ability to involve in social life, and also their mood and personality. So these are the major activities which our brain involves in terms of cognition. So among these, we will be looking at which is normal and which is abnormal. So memory loss, which is disrupting daily life. So there can be certain normal forgetfulness also, like we may forget some appointments, we may forget to pay some bills, but if we are able to remember them later, so then it is not abnormal. And also if it is happening at a very less frequent interval, it is also not abnormal. But when we are forgetting very recently learned information and repeatedly needing to ask questions to know them, or repeatedly telling the same things, forgetting that we have already told them, and requiring help for reminding the things that they used to do by themselves. Like, for example, they may need to write down things, or even sometimes, like, even that will not be helpful. So they need some family members to keep reminding them of that. So only in that case, we consider it as abnormal. But if it is like sporadically now and then we forget something, but then we remember later, so we forget where we have kept certain things, and later we can retrace our steps and find them. Or even if we forget appointments after a few days, like we remember, oh, that we have forgotten to do this, so we have to do it. So in that case, remembering it later is not considered as abnormal. And with the challenges in problem solving, so certain things like for example, if we have to plan a travel, we need to first plan as to like how we are going to book the tickets, and then if we have to board the train, or if we have to catch the flight, so we need to plan our trip, like you have to be at this at that boarding point these many hours ahead, or some minutes ahead of it, and then and the airport, which gate to take and all. So such planning or problem solving things. So if it is occasionally, if some mistakes are made while handling finances or bills, it is okay. So instead of recharging our number, like if we put one wrong number and we recharge it once, so occasionally such things happen to all of us. So those are not considered as abnormal. When it is abnormal, we call it as executive dysfunction, which is a symptom of impaired planning. So there will be a consistent difficulty with following a plan. There will be consistent difficulty with working with numbers, for example, making calculations or remembering a set of numbers and like using them within a few minutes, or difficulty with following a familiar recipe, and difficulty with concentrating. Like if there is attention, which there is a sustained attention which needs to be given, if there is difficulty with doing it, and taking longer time to complete chores than usual. So these are considered as abnormal. So, and also difficulty with completing familiar tasks. Occasionally, if we need help with some gadgets, like new, I mean, like these days, everything is like very technically advanced. Like, for example, just even a television, which used to be a very simple thing earlier. Now all like Android TVs are there, and all these applications and all. Like, if you occasionally need help with managing all those, then it is not normal. But a skill task which you had known already. So if that person is not able to do it, like it's the caregivers also feel like this is a very complete change. This person used to do this task very effortlessly, but now that person is not able to do it at all, getting very confused. So in that case, it is considered as abnormal. And confusion with time or place. So normally, sometimes we may not able to remember which day it is or which date it is, and we might also be writing wrong dates somewhere. So if it is happening one few times, it is okay. But extreme difficulty with keeping track of even the seasons, date, and also difficulty with wayfinding in familiar places. So those are considered as abnormal. And difficulty with spatial relationship. So if it is because of some vision disturbances, that happens very quite commonly in older adults. So it is fine. So if it is because of some vision impairment which is causing it, it is okay. But if there is difficulty with judging the distance, for example, a person who was driving very well earlier, so now that person is not able to judge the distance of the vehicle ahead, and also there is a loss of balance and all. So those things are considered as abnormal. And problems with speaking. So occasionally we also have difficulty finding the right word. So we think for a few minutes, like, what is that word we wanted to say? Like, but sometimes it doesn't come at all. But if it is occasional, it is fine. But if a person has difficulty with following conversations, totally, like not able to make sense of what is being told, what is being spoken, and also stopping midway and having no idea how to continue, and difficulty with vocabulary. For example, even if they can't name certain things, like very common things like a pen, they may substitute it with something else, like calling it a thing for writing and all, like such very common things. If they are not able to name, so then it is considered as abnormal. And misplacing things. This, I think this is the most common complaint that everybody has. So occasionally if we are misplacing things, but later we are able to think like, what did I do before keeping it there? So when was I using it last? All these things we are able to recollect, and then we are able to trace our steps back and find them. But if a person is keeping things in unusual places, for example, if the plates that are used for eating, if it is kept in the wardrobe, or food items, half-eaten food items kept somewhere in unusual places, and inability to retrace steps, and having the suspicion that because I am not able to find it, maybe it is being stolen, and accusing others of stealing them. So all these things are abnormal. And poor judgment. So occasionally all of us are taking some bad decisions, but when it is very consistent, and yeah, for handling money also, like if it is always like making some wrong investments, or trusting people who are not actually trustworthy, giving them money, and losing objects like that, and also not paying adequate interest to cleanliness or hygiene. So these are the things which are considered as abnormal. And also withdrawal from social life. So whenever a person is having a dysfunction with memory or thinking, so that person might not be able to connect well with other people. So this actually the main reason being problem with memory or thinking, but it may manifest as the person withdrawing from social life totally. So so then we should always be watchful of that also. And if there is any change in mood or personality, a person who has like completely changed, like 5 years back, he or she was a completely different person. So now that person has become very suspicious, fearful, or depressed, and that person like has a comfort zone for himself or herself, and they easily get upset if their routine is changed, and all like such changes when present and are consistent in this, these are considered as abnormal. So so a person who is having an abnormality in all of the these mentioned things, so it may either be a person who is progressing to having a dementia, or there is another stage of illness which precedes dementia. So I think the participants of VayoManasa Sanjeevani are well aware of the condition called dementia. So dementia is a disorder of the brain where the brain's functioning starts declining. So the person loses his or her independence in a lot of things, uh, like it can be going to a bank, or I mean, like taking care of their own finances, or preparing their own food, or making telephonic calls, or sometimes the dementia progresses to such an extent that the person may become dependent for even the self-care. So a few of you would have actually had personal experience with person with dementia. Few of you would have had second-hand information also, or third-hand information. So I think all of you are very familiar with the term dementia. If not, when this presentation is over, we can have a discussion about that. So dementia is a condition where the person has lost their independence in most of the things, but uh, it doesn't progress from normal to dementia just like that. So there is a condition called mild cognitive impairment, which is to be I mean, like to put it out simply, it is a stage which precedes dementia, or you can also consider it as a pre-dementia, where the person is neither in the normal cognitive functioning, nor in the stage where the person has become so deteriorated to call it as dementia. So what is it? What is mild cognitive impairment? It is an early stage of memory loss or other cognitive abilities, serious enough to be noticed by self or others. And it is very consistent. It is not like the normal things which I had told you. It is, so this person has difficulty with this. So maybe that person will always have difficulty with it. 10 out of, I mean, like 10 times of attempting it, at least 8 or 9 out of 10 times that person will be not able to do it. So this, but it is not very serious enough so that the person has lost the independence completely. And they maintain their independent functioning in most activities of daily living. So this mild cognitive impairment, how common it is? So this is not very common. Also, it is not so uncommon that we can overlook it. So most of the time, it is not brought to the light because it is often confused with normal forgetfulness. So if somebody is forgetting, the person maybe I mean, like there is a prejudice, like okay, that person has is old, so that is why they are forgetting it. So it is often it is being considered as a normal part of aging, so it is often overlooked. But around 12 to 18% of older adults in the all over the globe, they live with mild cognitive impairment, and this prevalence is also similar in India also. So what to do if a person is thinking, a person feels, or the person's family members feel that this is an abnormality, it is consistent, so it is something which needs to be definitely addressed. So in that case, so what should be done? So sometimes it is caused by conditions that are treatable. So for example, a person may have anemia. I mean, anemia as in like the hemoglobin, lower hemoglobin levels, very poor nutrition, or the person is probably not adequately stimulated in the home environment, like after retirement. So some people have the privilege of being very active after retirement. Some people might not have that privilege. So those people, like if they are not adequately stimulated, so that time also like they might be having some difficulty with all this. Like as the more we use our brain, the better it would be functioning. So that is another reason. Another very common reason is depression. So depression is often over, like I said, like mild cognitive impairment. Depression is another thing which is most oftenly overlooked in older adults, because they most of the time like they are not very socially active, and also they family members also like they don't get to spend enough time with them. So most of the time it is overlooked. Even a person with depression might also have problems with memory. So those are certain conditions which are treatable, and it can be completely reversed. So if somebody feels that their memory is not like before, it has come down. So in that case, it is better to visit a doctor and get themselves checked for memory. And if the doctor also advises some tests and finds that okay, this person has low hemoglobin, or this person has lower levels of vitamin, so in that case, if it is substituted, then it will be completely reversed. So even if there is no treatable cause we are able to find, so it is not necessary that so you got a mild cognitive impairment, oh okay, so life is done, like next stage is dementia. It's not like that. So a few people with mild cognitive impairment, they may not progress to dementia at all. Few people may even come back to their normal functioning after some time. So it is only a small proportion of people who will be progressing to dementia. So every 6 to 12 months, getting assessed for the memory and thinking. So that is also advisable. So as I told, so a person with who is in the process of normal aging. So around 25 to 30% of them will probably come to mild cognitive impairment stage in their lifetime. So out of the people with mild cognitive impairment, oh, I'm so sorry. So the people with mild cognitive impairment, 25 to 30% of them will actually go back to normal functioning in their lifetime. So only 5 to 10% of them are converting to dementia every year, and 50% of them might convert to dementia in 5 years. So this is the statistics which is there. But the good thing about mild cognitive impairment is that it is not always progressing to dementia. So key things are: one, it is it could also be caused by certain things which are certain conditions which are treatable. Second thing, if we are having a very healthy lifestyle, and if we make some changes in the lifestyle, and we take care of our blood sugar levels, BP levels very well, and if we follow a healthy diet pattern, so there is a 25 to 30% chance that that person might convert back to normal functioning. So this is about the mild cognitive impairment. And so there are certain risk factors and there are certain protective factors for this. So risk factors are: certain things are not modifiable, like age is not a modifiable condition, educational level is not a modifiable condition. So we will not be talking about the non-modifiable conditions which are risk factors. So I will be saying certain modifiable things, conditions which are risk factors, which are obviously diabetes, hypertension, and abnormal cholesterol, obesity, smoking and drinking, and having any depressive episodes in the past. So those are certain risk factors which can be addressed. And so there are certain protective factors also. So if someone is having memory impairment, so if they take good control of their BP, and they follow a dietary modification, like there are certain diets which are recommended for diabetes, also for hypertension. For example, a low salt diet for hypertension, and also a Mediterranean diet. A Mediterranean diet is a form of diet where there will be a lot of whole grains and or less fat. I mean less bad fat and more of good fat, and a lot of greens also, and with low salt, and also adequate physical activity, and maintaining some higher level of mental activity. Like it's not like some person has to go and learn something new. So probably that person had been doing it earlier also, like during their work time they didn't find time to pursue all that. So if they are able to go back to that, for example art or reading, or just the fact that being socially active on the internet, or like meeting friends and having a very good conversation. So all those mental activities are very good for or very good, and also are protective factors for a person who is having a memory impairment. So this is about it, and I thank all of you for your patient listening. So yes, I think there are a few questions on the chat.
Thank
No,
you
there
so
are no
much, ma'am,
questions.
for that wonderful presentation. Now, the panel is open for the audience also to ask their questions, and you can share your experience also. Smita, on to you.
Yeah, ma'am, first of all, if we go with this, ma'am, what are the causes that will
Causes for mild cognitive impairment, is it?
Yeah.
Or
we'll start with the mild itself, ma'am, first.
yes. So mild cognitive impairment, like as I told, like there are certain non-modifiable things also. For example, if a person is having a family history, like if somebody, their father, mother, or sibling, somebody had dementia, so that person might is also at risk for mild cognitive impairment or dementia. So that is something which we might not be able to modify. But there are certain things which are more of like, those are more of like physical health things, like as I told, poor nutrition, and certain deficiencies like iron, or vitamin deficiencies, or even thyroid problems, or there can also be I mean like thyroid problem need not necessarily start at young age. Like it can also be something which starts after 60 years of age. So thyroid problems is another cause, and mainly the thing which is most often overlooked is depression. So if the person is having a problem with memory, we might also need to be very keenly watching if the person might be having depression. So that is another very treatable cause of this mild cognitive impairment.
Okay, there's a question in chat box from Narendranath Vasudev. Sir wants to know the warning signs of mild cognitive impairment, ma'am.
Hi, sir. Thank you for that question. So the warning signs, as I told, are if the person themselves feel like okay, I am not able to do certain things independently like before. For example, they may be having difficulty with finding where they have kept their things, and also if they might be forgetting certain appointments, forgetting to pay the bills and all that. So it's if the persons in the family also feel that this person is consistently forgetting, or is consistently having difficulty with finding the right words when they are speaking, so it's like they are not speaking like before, and their understanding capacity has changed. So those are things which the more of like in case of very knowledgeable older adults, the person themselves might be able to appreciate it, or a person who has been having a close watch on them, for example their spouses or their children, so they are also finding that the person is having consistently finding it difficult to remember. So those are the things, warning signs that should alert that person. I hope I have answered that question, or if I have not clarified it adequately, you may let me know.
Can I? Can
Yes.
I ask?
Yes, sir, you can please speak.
I have got two small questions. Matlab, answers may be big, questions are very small. One thing is, it's whatever you have told about is very subjective. For example, for me, when I sit, I will forget the name of that very nice place, Puar. I will tell my wife, the place where we had gone 5 years back, where my daughter has come from US and we came together and we went together. And then she will say, oh, that was Puar. Similarly, some relative, I will forget his name. I'll ask my wife, that one, my brother, sister, so and so, so and so, so and so. So this happens quite often. And whatever you have told is very subjective, very difficult to say where do I stand. One thing. Second small question is, you have talked about BP, blood sugar, thyroid. I am taking, and as per my doctor, very small medicine for all the three, but for years, all the three are under control. So whether it will be considered I am a diabetic or not, whether I'll be considered I am having pressure, blood pressure or not. So these are the two small questions, madam.
Yes, sir. About your first question, so even I agree that all these things are very subjective, because it's not like what is normal for you may not be normal for another person. So of course it is very subjective, but this is something, it's not about how much you have changed from what is socially acceptable or what is socially considered, widely considered as normal. It is for that specific person, that 2 years back or 5 years back, so this person was able to do all this, so which was normal for that person, and now it is, he or she is not able to do it. So this is the level of, this is the, I mean, like, we are not measuring it based on some very general scale, but we are considering that person's normal as the normal, where against which we are measuring all this. That is one thing. Second thing, about this, I mean, like, the second part of the answer is about, see, when you meet your doctor, so that doctor will be advising some tests which are called neurocognitive tests. Like, there are certain paper and pencil tests, and there are certain computerized tests also, where we those tests are like, have a very tedious process of development, where we will also have a very, I mean, like, we will have devised it in such a way that we will be able to exactly tell you, like, what is normal for your age and for your educational qualification. So if on that test, if it's a very, what to say, it's a very what's I'm not able to find the right word now. So
No problem, no
it's a
problem.
very comprehensive, yes, comprehensive.
Yes.
It's a very comprehensive test, where we will be able to get to know. So if you're undergoing that test, then we will get to know whether it is exactly normal or abnormal. Like, as you said, like, it's always, a person's perspective is always very subjective. So it's not like we are diagnosing a person as having mild cognitive impairment just based on subjective information. It's also based on objective tests that we actually do. And to answer your second question, so even though these diabetes, BP, and high cholesterol are all considered as risk factors. So if a person is having all these, any of these, so the person is definitely at risk for having cognitive impairment, but it is being at risk and having attributing them as causative factors are two different things, aren't they? So if you can say, like, a person, for example, if a person is traveling without a helmet, So that person is at risk of having a road traffic accident. It doesn't mean that anybody who is not wearing a helmet will almost always suffer a road traffic accident, isn't it? Yeah. So those are considered as risk factors. But a good thing is that if the person who is already having the risk factor is having it everything under adequate control, so then that actually serves as a protecting factor than as a risk factor.
Thank you.
Thank you, sir.
Ma'am, regarding this, when you spoke about the assessments, are there any self-assessment tests also, ma'am, or should it be done with professionals itself?
Self-assessment tools, as in like there are certain caregiver administered tools which are there, like, but all those are like as I told, like very subjective.
Okay.
So we might use them as screening tests, but to establish a diagnosis of having a cognitive impairment, it would always be good to go for objective tests.
Okay. Is it always the cause of medical conditions only, health conditions only, that causes mild impairment or cognitive impairment? Or suppose because elderly people sometimes may have a skid and fall and all, like hit on a head and all. Will that also be effective, ma'am, to them?
Yes. So it's as I told, like it's not always medical causes. As you told, like there are certain surgical causes also. Like for example, if a person, I mean, like as you told, older adults are like very prone to falling. So just falling and having a superficial injury, it might not be a risk factor. But if a person has some internal hemorrhage or because of the fall, so in that case, it would also be a risk factor for this. And other thing is not just physical, also emotional issues are also contributing factors. So depression is one. Also a person who is having anxiety and who is a person who is like undergoing some extreme stress. For example, a loss of a loved one, or have some financial losses incurred. So all those are like extremely traumatizing issues for any person, more so for an older adult. So even they can be causes for a cognitive impairment, but the thing is like it's very temporary. So that is all, be it physical issues or be it emotional issues. So those are actually things which can be treated.
Are there any customized treatments depending upon the person's conditions, ma'am?
Of course, there are. It can be customized based on like if we find an underlying cause for it, so we should be targeting it, and proper management of their diabetes, hypertension, and if they are having any habits like smoking or consuming alcohol, so those can be stopped. And still we are not able to find any cause, but the person is definitely having mild cognitive impairment. So apart from having this a healthy lifestyle, which say like at least 150 minutes of physical activity per week is what is recommended. And also being socially active is also recommended. And so if all these are mild cognitive impairment is not a condition where there will be specific one treatment like other medical or so it could be a multimodal approach. So they following a healthy lifestyle and also involving in some cognitively stimulating activity, like playing a simple what to say, a simple Sudoku game on the mobile, or solving Sudoku. So such activities. And also there are certain newer modalities of treatment also which is available, certain brain stimulation methods which based on the person's condition the doctor can prescribe.
So meditations and healthy lifestyle will help to improve our memory related issues. Okay. And regarding the support system, ma'am, such persons do or should always depend on the family members, one of the family members. Will that again put them into anxiety, or is it always a family member be a support system? Are there any other ways where they can help themselves? Is there any such things, ma'am?
Of course. The family would be the largest support system any person can have. Apart from that, there are also other things that can be done. Like it, as a person with mild cognitive impairment, it is not like they become completely dependent on others for their, like for their care. So they may help themselves also. Like, uh, for example, having a calendar on your phone, marking certain important appointments or certain things to do. I mean, like we also can have a things to do list on with us. And if the person is consistently forgetting where they have kept their things, so having a designated place for all that. So these are certain adjustments a person can do to accommodate their memory impairment.
Okay. Any case would you like to share with us in your this much of your experience? Kindly.
Based on my experience, like what would you want me to
Any
share?
cases with mild memory issues in
Uh,
older.
Sorry, I didn't get your question. Sorry,
Any
any?
case which you have come across in
Okay. Yeah, as I told you, it's a very common condition. So there are quite a few people who come to us, but I mean, it's a confidential issue. I cannot actually share any information about them, but I can say that there are quite a few people compared to how it was previously. Now there are quite a few older adults who come to us with memory impairment, and we also, as much as we find people who are actually having impairment, we are also finding that there are people who are actually normal for their age and education. So it's I mean, like we are seeing both uh, I mean, like it's we are seeing both sides, like a person who is having an issue eventually turning out to be a person with normal cognitive abilities. Also, a person who thought he or she was normal, us finding that that person is actually having some uh, what to say, the cognitive impairment. So we have seen both.
Thank you.
Participants.
I will request
Yes.
the participants to ask a couple of questions. Yeah. Devendra sir have raised his hands. Can you ask your question, sir?
Can I?
Yes, sir.
Yes,
Please
yes,
go
please.
ahead. Following that, Devendra
Can-
sir can ask the question. Please go ahead, sir.
Hello.
Yeah.
Yes, sir. Yes, sir.
Okay. Can you tell us what the doctor is called who is dealing with these type of problems?
Yes, sir. So we are a team of where it's a geriatric psychiatry team. So at NIMHANS, so we deal with it, and also cognitive neurologists are the other group of specialists who deal with it.
So this is a part of psychiatrists.
Yes, yes. It's kind of an interface between psychiatrists and neurologists. So both of us are like well trained in this aspect.
So we can discuss this type of problem with our psychiatrist.
Of course, yes.
Oh yes, thank you, thank you. Wanted to know that one.
May I, madam?
Sure, ma'am.
Okay. Thus, reduced attention or reduced focus is also a symptom of mild cognitive impairment.
Ma'am, actually, it also depends on, yes, it is, if you, I have to answer that directly. I would say, yes, it is a symptom, but it should also be looked at the context. For example, reduced attention could also be contributed by other things like sensory, I mean, like hearing impairment. So that is one thing. And other thing is like if there are a lot of distractions around them. So older adults may find it difficult to focus their attention when there are a lot of distractions around them. So that is quite normal for any older adult. So if this difficulty with focusing is like very consistent and it is impairing them to such an extent that they are not able to do the things that they were able to do before. So in that case, I would say it is abnormal and it is uh, uh, probably a symptom of cognitive impairment.
Because otherwise his normal functioning, every other things are okay. Sometimes, when we tell him something, or maybe he's not interested in what we say, the family members, the men and senior citizens, as we just behave like that. Those things which we are not interested to listen to, so we may just ignore that. Or is it a kind of just that, or it's generally it's happening like that. So anyway, the topic was there, so I thought I would ask you. Yeah.
Yes. So I would request you to look at the context in which it is happening.
Yes.
And if it is consistent and it is not
Yes.
context specific, so
Yes.
then it would be a good, I mean, like a good advice that I would give you is to get tested so that you can be sure that it is normal or abnormal.
Yeah. Even when you're saying, they say, no, you never told me these things. So because we are very for sure that he was very much present at the time. I said, no, you never told me. So had you told me, I would have brought it, something like of the kind. This is often it's happening. So I wanted to know about it. Okay.
You
Madam,
need
is it a
any help
general
with,
factor that, sorry, madam, is it a general factor that as we grow old, this kind of attention gets reduced, or is just our thinking?
Yes, of course. Attention as a person ages, no, like their capacity to pay attention to things, focus on things might not be the same as how it was when they were adults. But we also have to look at how much it is impairing them from performing their activities.
Because obviously, if we cannot focus, we tend to forget. Right.
Yes.
Thank you, madam.
If you need any help with getting assessed, you can always contact us with the through the VayoManasa Sanjeevani number. So and we can always help you out to get. I mean, like whoever you are talking about, we can get them tested.
Oh, thank you, madam. Thanks.
Ma'am, we have a question from YouTube from Mr. Mahesh Hemadri.
Yes.
How do you test abstract thinking in elderly? Does it get affected in MCI?
Yes. So generally, we test like the abstract thinking that we test, like we actually a very what to say, a bedside test that we do is to ask them about, I mean, like giving them giving them example of two things and asking them to tell what is similar between those two or what is common between those two. For example, a banana and an orange. So what is common between the two? So if the person is able to find the concept behind it, like for if they are able to say like both are fruits. So this is a very simple bedside test that we do. There are also certain other tests like paper and pencil test, and also I mean like a lot of performance tests that we do to find it. So in mild cognitive impairment, I wouldn't say it is the first thing to get affected, but definitely, like if a person is cognitive abilities are coming down, so abstract thinking is another thing which is what to say, which might be affected. And as I told you, like in dementia, like there are different variants of dementia. So in mild cognitive impairment also, like there are different variants. So a very common variant is called the amnestic variant, where the person will have most of memory disturbances. So there is another variant called a non-amnestic variant, where apart from memory, certain other things are getting affected, like for example language or judgment and this abstract thinking. And also it is also a symptom of mild cognitive impairment, probably of the non-amnestic variant.
Thank you, ma'am.
Yeah.
We have Devendra sir have raised his hand. Can you just answer questions?
Madam, good evening. I am a Kundi. I am a counselor.
Yes.
I am 67 years old. No BP, no sugar.
Okay.
Hypothyroidism is there. And sometimes I feel like losing my right word. Just now you pointed out. I miss
Yes.
right word for the places or some technical issues. My problem is notice long back since college days.
Okay.
This is happening to me, and where to contact about this and OPD or any other.
Sir,
treatment?
actually, I think you can. There are two ways that you can contact us. One is through the VayoManasa Sanjeevani number. So
Okay.
they will help you in getting in touch with us. Or if you would also like to walk in, you can just make an appointment. You can also make an online appointment, or you can just walk in and get yourself registered. And
Okay.
you can come to the geriatric psychiatry screening OPD, which runs on all days, except for non-OPD days. For example, Sundays we will not be there. And also OPD holidays are there. Certain OPD holidays, like tomorrow is Ramzan, so it's OPD holiday. So there are certain designated holidays. So apart from those days, we have the OPD on all days. So you can just walk into room number 903 at gate number 1 after registering yourself at the registration counter.
Okay. Thank you.
Yes.
Any other question from the participants?
That is the gate number 1, 903.
Yes, sir.
Thank you.
Excuse me. Whoever wanted to have an appointment, can contact me also. I can also direct you, help you to get the UHID, your hospital ID, and direct you. So you can contact VayoManasa also, or like ma'am have said, you can come directly to NIMHANS, get the UHID done, and go to the screening. Thank you.
Thank you.
Excuse me, doctor.
Yes,
I'm
please.
Leela Reddy. My parents are 90 plus and they are very forgetful and all those things. We have accepted them for because it is age related, we have accepted them like that. But sometimes it tests our patience.
Okay.
So can we do something at home only, any activities for them?
Yes. So before going to that step, no, like I would say, I mean, like you can, I mean, like get an appointment and get them evaluated by the doctor. So, this as much as we discussed before, no, like as much as it is subjective. So to prescribe what activities to do and what kind of interventions need to be done, that is also to be decided on a person to person basis, ma'am. So generally for someone who is having some problems with memory, as discussed earlier, like we can involve them in some cognitively stimulating activities. But if we it is also better to if you feel that like they are having some definitive impairment, which is I mean, like they probably will have some impairment, so that the activities which we are saying in general might not suit them.
Okay.
So it would be better to decide it on a person to person basis.
There is no age limit.
No, I am not. I'm saying that we can decide it on a person to person basis rather than generally prescribing this for your parents.
Okay. Thank you, doctor.
Yeah, sure.
Madam, this dementia there is no cure.
Sir, dementia, it's it's a very it sounds like a small question, but there is a lot of there are a lot of things to say about it. So dementia is a condition where I mean, like it's as you told, like it's not fully treatable. Like we cannot say give treatment for somebody and say that they are cured of dementia. So it is a process where the person's brain slowly loses its activity. So of course there are interventions which can stop that progression from a person, like actually happens because of the loss of the brain cells because of certain chemical abnormalities. So if we are able to stop that process, so that person, the progression of the illness can be stopped. But I wouldn't say like there is a complete treatment for dementia. So yes, to answer it in a few words, but it's a very complex question that you've asked.
Good evening. I am Tangaraji speaking.
Hello, sir.
Good evening. Mostly senior peoples are separately put into a room. Relatives, friends are not able to get conversation with them in person or even over phone. That's one problem. They have been given food and cleaning and other things, but nobody, because they are children, grandchildren are busy with their activities. Even in joint family, the people are not morning or evening or 10 to 15 minutes. They are not able to talk with them to get memory, retrieval of memory like that. Their old function, attend of function, family relatives functions. Like that, we have to get some contacts. This will be reduced to some extent. This is my view.
Yes, sir. I totally agree with what you're saying. So, being less stimulated is also another reason for cognitive impairment in late life. So, person apart from being socially active, should also spend a good amount of time with their family members I mean, like it serves two purposes. One is that emotional connect that you get with them. Second thing is you get in get in touch with the real world. So you will be in good touch with the real world, like if you are spending good time with your family. So I agree totally, sir.
Apart from counseling, medicines, and other things, the inner they are having some inner problem which they could not freely inform to the nearest family members, relatives, and friends. Particularly for the past 2 years, they are not able to attend any functions, interactions.
Yes.
More problem for the past 2 years.
Yes. You're talking about the pandemic situation. I understand. Yes.
They are kept in. Youngsters are going. Please keep watch the home like that. We will come back like that. This is one way or other. They feel humiliated. Loneliness like that.
Yes. I agree with you, sir.
Thank you very much.
Ma'am, upon the same thing, what I would like to ask is, how do you educate patients and caregivers when they are diagnosed with dementia or low mild impairment? And
so the mild cognitive impairment. So the education that we have to give is like we have to tell them. Mainly, they will be worried about the prognosis of that condition, like what will happen now after this. Like if someone is diagnosed with mild cognitive impairment, so what happens? Like, is it a condition? Is it a progressive condition, or will it get cured? So all those questions we need to address it by telling them the real facts. Like mild cognitive impairment may or may not progress. So, and it sometimes it can also be reversed back. So that is one thing that we need to educate them about. Second thing is to follow a very healthy lifestyle and to involve in as much as mentally stimulating activities as they can, and also to keep their diabetes, hypertension, and all under control. Ask them to be socially active, and other thing is, the other part of it is to actually identify where they are having the deficit. So in that part, like what kind of help they might need. For example, a person is not able to manage multiple bank accounts. Like somebody might be very, I mean, like for example, someone who was owning a business. So they might be having multiple bank accounts. So now they are not able to manage all of them. So what to do then? Like they might need help with that. Or if there are certain very complex things that they are responsible of, for example, managing finances or managing property or all those things. So in that, what kind of help they might need. Or if the person is at risk of I mean, like at risk of losing their way if they are left alone in unfamiliar environments. So in that case, what needs to be done? So all those things, also on a person-to-person basis, we have to find like what, in what way this cognitive impairment is impairing them, and how, as much as we can, we need to accommodate all those things, and we might need to help them out in those, if there are any things that they need to still do, but they may need help for.
Okay, thank you, ma'am. To the participants, if you have any questions, kindly you can ask.
I request Wednesday, coming Wednesday, there is a Tamil program. Kindly inform participants to participate about senior citizens, present day condition and community support, like that. Thank you very much.
Okay.
Sure. Any other questions? I think we are at the end of the webinar. Thank you so much, Subhashini ma'am, for addressing all our inquiries and giving us so much of information. And I thank all the viewers also, and the panelists by VayoManasa Sanjeevani team. Over to you, Gina ma'am. I thank you also for giving us this wonderful opportunity.
Thank
you so much. Yeah, thank you so much. I would like to thank Subhashini ma'am for that wonderful presentation and taking up all the questions and answering our participants. And thank you, Smita, for moderating our today's session, and all the Zoom and YouTube participants who have joined for today's session. Without your support, it's very difficult for us to, conduct every week sessions. Your support is really a great thing for us. So with that, I would like to thank all our partners, Government of Karnataka, Indian Psychiatric Society Karnataka Chapter 1, Karnataka State Legal Service Authority, Bangalore Apartment Federation, Happy 60 Plus, Samadhana Counseling Center, Icon Life Science, REC Foundation, and NSC Foundation. Once again, thank you all for joining today's session. Have a wonderful evening. Thank you.